Hello, my name is Allie, and this is going to be my video for recording urinary output. The first thing that I would do is wash my hands. Hello, Miss Jones, my name is Allie, and I'm going to be your CNA today. I would pull the privacy curtain, and I would make sure that her bed is completely lowered, the bed brakes are locked, and that she has her call light in hand. Miss Jones, is this a good time to measure your urinary output? Yes, okay. I'm just going to leave the room to go get my supplies. So I would leave the room and I would gather my supplies, which is one barrier paper towel. I do not have paper towels, so I will be using this washcloth, and then one pair of gloves. I would re-enter the room with my supplies, and I would go into the area where her bedpan is. The first thing that I would do is I would lay out my barrier towel and put on my gloves. Alrighty, the next thing I would do is I would get my measurer and I would set it onto my barrier towel. Then I would take my patient's urine and I would dump it into the measurer without splashing or spilling. I would then rinse out the bedpan and dump it into the toilet. Then, assuming I had paper towels, I would dry this out and set it aside. The next thing I would do is I would come over to my measurer and I would get eye level and I would measure their urinary output. I would then dump their urine into the toilet. I would then rinse out the measurer and dump that into the toilet. I would then take these two items to the designated dirty area. I would then return and throw my paper towel away or my cloth into the designated dirty linens. The next thing I would do is I would remove my gloves without contaminating myself and throw those away. I would then wash my hands, and then I would leave the room to record. And, record 350 milliliters of urine. Okay, and then I return into their room for my ending steps. Alrighty, Miss Jones, it looks like we're all finished here. I'm going to make sure that her bed is completely lowered and the bed brakes are locked. I'm going to make sure she has her call light within reach. I will remove the privacy curtain. I will wash my hands, and that skill is completed.